I'm Dr. Jacqueline, and I'm here to talk about what and how to eat for oral health. Whether you eat to live or live to eat, your food intake affects your oral environment. Most people eat the equivalent of 40 kilograms of sugar a year. This is one of the main causes contributing to tooth decay. Limit your intake of chewy and sticky foods. Foods such as caramel or granola bars can stick to the surfaces of your teeth, and because they are sticky, they take a long time to be cleared from the mouth. Sugary snacks like pastries, cookies, sweets, and fizzy drinks should be limited as well. Fruit juices are also high in sugar and contain acids that can erode tooth enamel. This makes them almost just as bad as regular fizzy drinks such as Coca-Cola. Beware of sports and energy drinks. These are also high in sugar. Plus, when you exercise, your mouth gets dry, so you're less able to fend off the acid attack. Our bodies and mouths are home to trillions of bacteria. These comprise both good and bad bacteria. Together, they make up what is known as the microbiome. These microbes grow on the surfaces of our cheeks, tongue, teeth, and gums in a complex network of sugars known as biofilm. Biofilm is multi-layered and is very sticky, so that means it cannot be removed just by rinsing alone. In a healthy mouth, there are a greater number of commensals, or what is known as good bacteria. These bacteria keep the pathogens, also known as the bad bacteria, in check. What you eat can tip the balance in favor of the commensals, the good bacteria, or in favor of the pathogens, or the bad bacteria. When you eat starch, your salivary amylase, which is an enzyme, digests the starch and it turns into sugar. Harmful bacteria within plaque will absorb this sugar and excrete acid. This is what forms a cavity in the tooth. So how do we tip the balance over to our good bacteria? Here are my top tips for eating smart. Tip number 1, avoid snacking. Every time you eat, there is a spike in acid production. In a normal healthy mouth, this can take up to 20 minutes to go back to normal. So try to limit yourself to 4 sugar exposures a day. Cleaning your teeth after your meals will help, but mouthwash alone is not enough. Tip number 2, avoid sweetened beverages. If you absolutely must have that cup of coffee in the morning, choose an alternative sugar like xylitol, which is antibacterial, for your morning cuppa. Tip number 3, food patterning. You may want to consider eating your dessert first. Sounds weird? By eating your dessert first and chasing it down with other fibrous foods such as vegetables, that increases the production of saliva by chewing, and the fiber in the vegetables acts like a chewable toothbrush. Tip number 4, eat your vegetables. Green leafy vegetables can stimulate the production of salivary nitrate. Nitrate can kill other harmful bacteria such as E. coli that can cause food poisoning, as well as other harmful oral bacteria. Not to mention, the fiber is also great for your gut microbiome. Tip number 5, have a cup of tea. Certain types of tea are high in fluoride due to the soil that they are grown in. Tea is also rich in bioactive compounds known as flavonoids, the most famous of which is called EGCG. Green tea especially has been shown to be high in EGCG, and these flavonoids have been shown to inhibit the growth of bacteria that cause gum disease. Tip number 6, choose your snacks wisely. Avoid processed and starchy snacks. Instead, go for unsweetened nuts and cheese. Nuts are high in trace minerals, and the vigorous chewing will stimulate saliva production. We know we must brush and floss to keep our teeth healthy, but our diet also has an impact on our oral health. By making smart choices about what and how to eat, you can help yourself keep your teeth for life.